We will now come to the discussion section. What I would like to do is I would like to take 2 to 3 rounds of comments and questions. Please be reminded that we have a very large online audience. So please use the mic, please speak clearly, and please be brief. Please tell us your name and your institution. And I would like to begin with questions from the audience here in the room, and then we will come to the online audience. For the online audience, please convey your questions and the comments to the various platforms. We will come to you in a moment.
Yeah.
So,
Olivier, I'll help break the ice. Thanks for the great presentations, really terrific. Just a quick question, in terms of the analysis, were you able to sort of tease out how the intensity of conflict might have affected the outcomes? Thank you. Aula Jelly from IFPRI, sorry.
Thank you for the interesting presentation. My name is Salamite. I work for the World Food Program based here in DC. I have one specific question. You mentioned that the cash was used by the households to buy mainly the non-staple food items. Do we know if these households had access to the staple food? I presume they must have had, either they had access to other income or food sources, or they had access to in-kind food aid. Otherwise, they would not have prioritized. So I would be interested to learn a bit more about that. Thank you.
Please hand your mic over. Yes, please.
Good afternoon, and thank you all for being here. My name is Julian Kyle Lewis from the American University here in Washington. And I think what we all know is that there are folks on this planet who lack the proper components that allow you to become a compassionate human being and put you on the path to becoming a compassionate person and a well-rounded individual. So my question is, what kind of psychological effect do you think it has on the minds of the children when they see that it's only the women in their villages who are receiving any form of monetary help, aid, or compensation for any of the services that they're putting forth? Thank you very much.
Let me take an additional question. Yes, please.
Hi. I kind of come more from the economic side. I'm curious, are these US dollars cash transfers? And if US dollars aren't available, then what else would be used under these circumstances going forward? We're kind of moving to a less cash environment both in Europe and in the United States. So going forward, how will these crises be handled with or without cash?
Would you please tell us your name and your affiliation?
Yeah, it's Amy McEwen, and right now I'm an analyst. So.
Thank you very much. So we have 3 questions and maybe more of a comment. So I think we had one question related to the design of the impact evaluation, and then a little bit more about the modalities. So I would like to maybe hand over the word to Lamis. Maybe you can address the second question, and then maybe Sikandra, you can comment a little bit on the impact evaluation.
For the cash transfer, it's in Yemeni Riyal, what I have mentioned for the household for nutrition.
As far as the analysis, there's a few questions on that, and also I take one of them pulling off on the comments also from Dominique. In terms of intensity of conflict, in the data that we collected, we didn't have a variable that varied enough, although since there's so much interest in that, it might be something that we need to do future research on, merging in some other data sets. In terms of, although I will say that there has been kind of conflict in El Hodeida, and people were definitely directly affected by it. In terms of the access to staple foods, we controlled for whether our respondents were in villages that had in-kind food transfers, and that didn't affect our results very much. Actually, if you look at the respondents who were in villages that got in-kind food transfers, those households did see an increase. It's not causal, but at least an association that they were consuming more calories from staple foods, but we didn't see the anthropometric impacts there. So again, kind of suggestive evidence that cash is better for improving children's dietary diversity than in-kind food transfers.
Dominique, Jacob, and Yashodhan, please let me know if you would like to
On the psychological effect on children of seeing only women getting benefits, I think Lamis and Yemenis can speak better to this, but I would say that these children are looked after by their mothers in the first place, so they probably, whether it's help from outside or the mothers look after them. And I think as part of this, when a child was identified as malnourished, the father often went to the clinic with the mother, right? So, so I would say that maybe that's not even that true.
Can I just add one more on the women getting the transfers? I didn't present it today since it's not as directly related to malnutrition, but we also looked at impacts on some measures of women's empowerment. And that's one of the motivations for giving the transfer specifically to women. And we did see that the treated women had higher aspirations for the education for their daughters and reported greater freedom of mobility within the village.
Yeah, and I would add 2 points to that. Sorry. The first would be that, again, thinking about the grand bargain commitments, that a process to increase the efficiencies of a humanitarian response. One thing, in addition to cash programming, is a localization agenda of having local ownership of humanitarian responses, moving away from the Western, the European, the Americans coming in and donating. And I think if you watch the video, you saw the entirety of that video was Yemenis working with Yemeni, and I think that in and of itself is an important component of it. And again, speaking to what Sikandra mentioned, empowering the women, and particularly the women as caregivers in this particular case, I don't know that that's an intentional choice to exclude men, but actually looking at the structure of the existing society and who is providing for the young children, it's women, and that way the response should be targeted towards the care providers. To the question about the dollar, I mean, in this particular case, you saw the bundles of cash, but in other contexts where mobile money has become an effective means of fund transfer, they've moved away from cash and they're using all sorts of digital technologies, and a lot of organizations are getting to that point. So I don't think it's necessarily predicated on the currency or the process, but the idea of giving the money as opposed to spending a lot of resources moving commodities, which can then also be diverted or prevented from reaching the necessary populations.
I may add something. It's just for how much equal in US dollar. The amounts that you have seen, the transfer to household per month, it's equal to $40 to $40 US, and usually it is transferred through financial institutions. But as suggested by Jacob, mobile, other like digital money is very limited in Yemen.
The volume of the transfer, that's also about 25% of household food spending, to give a sense of the magnitudes.
If I may add to this discussion on the dollar, quite the unique thing in Yemen is that even now, 4 years into the conflict, the local currency is functional, available. There has been inflation, there have been pressures on it, but unlike many other countries, there are functional currency markets, and that is something that helps continuing operating in the national currency. On the other point, I think in addition to what my co-panelists have said about the women being the primary caregivers in this case, and I think the choice of the woman as the primary beneficiary is also program specific. In this program, it makes sense, but it's certainly not the case that a child growing up will only see a woman or the mother getting benefits, because there are other programs, there are food transfers, in-kind transfers, employment programs on large or small scale, which are targeted at men. It really is about the particular aims of the program and who it seeks to target.
Katala, I would like to now come to the online audience, please.
Okay, so we have a few questions. The first question is from Nick at Save the Children here in Washington, D.C. This was partly answered, but his question is, what method was used to transfer the cash to households? Hawala, mobile money, and the part 2 of it is, and how was the liquidity on the ground ensured to meet the volume distributed? His second question is, Were you able to compare impacts in areas where the malnutrition referral centers were negatively affected by the conflict compared to those that continued to function throughout the conflict? And we have another question from Catherine, also at Save the Children. Her question is, how did you rationalize having a control group of equally vulnerable people that you did not provide with emergency food assistance? We have had difficulties justifying this within our organization, but we also want to have stronger data on impacts, so she's interested in hearing more on the ethics of this, please. Thank you. That was from Catherine from Save the Children.
Cash delivery, which is usually through financial institutions, local banks. And for the availability of cash in the market, there was like a crunch in liquidity, since the banking system was not trusted and the money is moving among the money exchangers, etc. But since we have a very strong ties with our financial institutions and banks, they were able to secure the needed amount for the transfer.
Sikandra, do you want to take the second question related to the regional heterogeneity?
We did a little bit of exploration on heterogeneity by health center characteristics. In the sample that we had, all of the health centers were operating, and we didn't see any characteristics that really distinguish the impacts clearly. But it's something that we tried to look at. Oh, and secondly, the question about the control group. So we were in a bit of a unique situation in that the evaluation was planned back when this was a pilot program that could only accommodate 5,000 beneficiary households. And at that time, we needed some method for selecting which 5,000 households got treated. We had the first priority group, which was direct beneficiaries, people who had the mother in the family of a social welfare fund beneficiary. And then the second priority group was mothers who were sisters-in-law or indirect relatives of the social welfare fund beneficiary. So the randomization happened within the group, which was second priority, which would have had to have a selection anyway at the time when this was a pilot program that had kind of a maximum capacity. Once the conflict started and it became a situation where the program was rolled out more widely, we didn't expect that we were going to be able to continue the evaluation. But when we checked on the ground, it turned out that the randomization, kind of because of an administrative inertia, they hadn't been able to sign up new people by the time that we asked them, and we said, let's go ahead and do a follow-up survey since you haven't had time to include those yet. So it wasn't, they weren't purposely excluded from the program.
Yeah, they were eligible for the following round of transfer. So those who were like control groups, they benefited from the program after we finished the evaluation.
From the World Bank's point of view, I'd like to say that when we came in to support this evaluation, it was by design meant to be an evaluation of a pilot. There are other programs we support in the country which are on a much larger scale, where it would not be ethical to exclude a certain group only to serve as a control group. We knew this evaluation would be of a pilot because we wanted its findings to inform our future work. For example, on whether or not there are impacts and therefore should this program be scaled up. As a consequence, we were able to mobilize additional resources through an additional round of financing because of this. But also to inform us on very specific design parameters. Is the amount of the benefit on average sufficient enough to see an impact? So, you know, on those issues, the impact evaluation of the pilot was meant to inform the fuller rollout on scale. More generally, though, I would like to make the point that for many interventions in Yemen, we are nowhere near full saturation. No program is able to meet the entire need there is right now. So, you know, that is only to say that it would be very hard in the current situation, apart from a few national programs that have been operating from before the conflict, to come up with a new program and not be able to find a control group only because resources are so limited compared to the needs.
Dominique.
I'll just add again, I think as Jacob explained very well before, the bottom line is that there's no money, and so you need funds. And the aid agencies, the funders want to know what works and what doesn't. So it's not about the control group. Any region you choose to go, or there's somebody in another region who's not getting it. So there's choices all the time, and only evidence can help, get funding, right?
Let me take another round of questions here from in the audience, in the room. We have one here, then Dan, and then Katrina.
Thank you. Hey, thank you very much for the panel. It's very interesting. My name is Joey Boyer. I'm from Bluemont. Actually, I'm helping support a program that does cash transfers to refugees inside of Yemen, in Sana'a specifically. And as you say, there's a lot of need that's not being met. So I'm curious, in some of our experiences, we've had beneficiaries who become violent or angry due to not meeting certain criteria to receive benefits or other cash transfers, or after a period of time, they're phased out. Do you guys have similar experiences with cash transfers or beneficiaries being disgruntled or even violent due to their status? So, thank you.
Thanks. This is a really interesting discussion. I have a couple of questions to follow up on the evaluation results and a bit of some of the issues that Dominique raised. And so, did you run intent to treat estimates, and was there anything to report there? We would expect those to be smaller, but I'm just curious whether you found effects there. I'm still not sure, I guess, whether the control households were also, I guess, the relatives of primary beneficiaries or not. So if you could just clarify that, and then I think you've probably done this quite a bit in the report already, but you'll be building up that kind of case for the robustness of results based on things that you weren't able to experimentally vary, but the size of transfers received by relatives, for example, which may vary a bit in your data. So you could just look at the plausibility of whether that seems to be driving some spillover effects. So also just wondering if you have any variation in people's access to the nutrition component of the program, again, just to build a story around plausibility of the relative contribution of cash or the sort of with and without the nutrition information. I know it's not designed that way, so I shouldn't ask, but I'm curious.
This was Dan Gilligan with IFPRI.
Thanks, Katrina Kosick, IFPRI. I've enjoyed everyone's comments, so thank you so much. My question is about mobility and trying to understand that better and what that implies for interpretation of what I understand are instrumental variables, results where you're looking at treatment on the treated. I guess I want to think about who is selecting into this program versus not and how mobility influences that. I heard something about transportation allowances easing in some sense the mobility restrictions on women, but I imagine there are a lot of other things beyond monetary restrictions related to social norms. And so I'm kind of curious what was present, what you've learned, how we can think of circumventing social norms and other mobility constraints in the context of social protection programs, what you guys have learned from this, and also just kind of how to interpret the results you have gleaned from this study in light of any restrictions. Thank you.
Sikandra, do you want to go first?
So the questions here were directed to me. Maybe the beneficiaries being violent, Lamis can address that. So for Dan's questions, first, intention to treat. Yes, and so in the full report, we present both sets of results, the treatment on the treated and intention to treat. Very, very similar, kind of exactly what you would expect. The treatment on the treated is like 25% higher. So it doesn't look like there's kind of very strong selection going into Katrina's question, but we don't know a lot about exactly what would drive some people to get into the program if they're in the control group. Obviously, there's people, these are households that were a bit more kind of energetic in demanding access to the program, likely. In terms of who the control group are, they are identical to the treatment group in that they are also households that had an indirect relationship with a social welfare fund beneficiary. And in terms of the balance test, they look quite similar. And our findings are robust to kind of controlling for the few things that differ, probably because of random chance between the treatment and control groups. Oh, and then the question also about what we can learn on spillovers. We did try and look at this a little bit. We have variation in the number of direct beneficiaries in the treatment community, and we didn't find any significant heterogeneity there. Maybe we just don't have enough variation to look at it, but yeah, it would be interesting. We couldn't find anything on that. Oh, and then Dan would also like to see if we can split out the effects between what's coming from cash and what's coming from nutritional training. Yeah, that would be super interesting. And given the design of the program, we really can't. It's a cohesive program, and the results we're seeing are coming from the combination of cash and training.
For them, I think question on the grievances and management of expectations of people, the cash for nutrition is rural based, and there is that sense of community, and management of expectations is I think your program is in urban areas where management of expectation is more difficult than in rural areas. But also, I think clarity of the criteria of selections and clear communications from the beginning about what is the expectations. This has reduced the grievances and the feeling of resentments once the program is phasing out. This is, I think, for the transportation allowance. It's a very important because sometimes people don't have the means to take their children to the health facilities, to the treatment. So the transportation allowance allow people to take their children to the treatment facilities. It has not only about the restrictions mobility of women, but also the income that allow them to take them to the facilities. The education also is very important because sometimes a woman, a family don't understand their child is malnourished. They think he was or she was born like that. So both the education, the role of the community educators is very important. So people will understand that their child is malnourished, but also the transportation allowance is very also critical to take the child to the treatment.
Jacob, can you share some of your experience with us?
Sure. I mean, maybe to Joey's question, I think this touches back on Catherine's question from Save the Children. If you pull back, the humanitarian sector, probably only behind the military, is probably the industry that's most fraught with ethical questions virtually every single day. When you talk about beneficiary selection, choosing one group of people versus another, or what you're fundamentally doing in this case is interjecting a commodity, in this case cash, but that has been used by parties to the conflict. Not the food insecurity is not, in this case, a consequence of the conflict, it's a tactic. And so the interjection by an external party of a commodity has really meaningful ethical considerations that need to be accounted for by the organizations that choose to do it. I think there's a tendency to say, oh, we're humanitarian, that's great. But in and of itself, that's not, because you have to consider the totality of the nature of the work that you're doing. And then I think I look back to Yashodhan's presentation and the discussion of the relief to development nexus, the relationship between development and humanitarian aims. In this particular case, it's not surprising that people who had been the beneficiaries or received an intervention and had it taken away would be angry. I've had the unfortunate experience of being involved in situations like that, and it's perfectly understandable. So what I think the takeaway is that these kinds of considerations have to be thought through from the conception of the program design at the onset. How are we going to manage the conclusion of this program? I mean, it's very easy to get yourself involved. It's very hard to extract. And then I also think the way that, separating aside the actual outcomes and the scientific, the evidentiary basis for the effectiveness of this particular program, I think you can look and say, if using a short-term infusion of cash that can allow people to buy what they need for nutritional diversity enables them to get into a nutrition educational program that will allow them to have better dietary outcomes when this cash dries up because of donor funding, that is, in and of itself, it seems to me, probably a net good. And so building in all of these components in program design, understanding the challenges of programs that are predicated on donor funding, when you're looking at, globally potentially a recession and money drying up in the United States political environment, all the discussion of recession, funding drying up, building into these program designs, the understanding of all these considerations, I think is essential to manage expectations and to be able to do so, to be able to do the totality of the program, which includes completion in a way that doesn't exacerbate tensions and create problems on their own.
Dominic, do you want to add? Joshua.
On this last point, I think it's very important, and I'm taking a step away a bit from the cash for nutrition intervention itself, but more broadly, the decision of who gets onto a beneficiary list or not is a key, something we have to keep an eye on throughout in an environment like this, because there is already conflict. This could give rise to disgruntlement and so on. So in every kind of intervention, this is something we have to take a look at. Some things that have helped, for example, with the Social Welfare Fund beneficiary list, which was present before the conflict, we knew there have been reports on it and so on that its targeting may not have been 100% perfect, but it was by and large working, and it was agreed upon as being politically neutral from before the conflict. So that is something that helps even in the current situation, when poverty has increased, when people have become poorer and so on. But also for new interventions, it's very important to set expectations correctly. And that's where I think the development perspective may sometimes vary a bit from a humanitarian impulse, in that many of the interventions are meant to be temporary, job opportunities, cash for work sort of interventions, and at levels of benefit which are far more modest than, say, a very large one-time transfer. Also keeping in mind some element of sustainability, that these things can carry forward to a government which may have to finance it out of their own budget sometime in the future. Once those things are taken care of, it becomes relatively easier to, not create expectations of continued access to this, and also working with communities to say that, this is what we have for now in the resource constrained environment, but we will have to move to other areas, other people. Those.
Let me come to the online audience again, Katala.
Okay, we have several questions. The first is from Samuel with the International Medical Corps in Yemen. Were there any challenges having community educators who are not community health volunteers? And how was this managed? Was it managed by government health officers, district health officers? The second question is from Wessam, who is in Sana'a, Yemen, and is with the Small and Micro Enterprise Promotion Services. Their question is, what would you do differently to encourage increased spillovers? We have another question from Farah Al-Wazir that says, given the evidence, will the World Bank reconsider its unconditional cash transfers provided to the Social Welfare Fund in favor of more investment towards soft conditionality? And the final question is from Nick with Save the Children here in DC. Did you establish any contingency protocols for price increases or market closures to deliver larger cash transfers, or switch modality if necessary, in particular if the transfer amount is no longer met?
I think most of the questions goes to Lamis and then maybe to our World Bank colleagues.
community health educators. This program is, by its nature, is a social protection, and one of the elements is to employ youth. So this is a job opportunities to youth as health, to employ health educators. But those educators, the treatment is be done by the guidance of the Ministry of Health and the health offices. So they are only directing, they are only educating the mothers, and also advise them to go to the health center treatments and give them the transportation allowance, and all these are conditional, that they are the allowance will be conditional that they are going to go to the treatment. So it's not involving that they are going to provide treatment or etc. This is when it comes to the health community educators. I think there is, this is for the spillover, maybe you can speak about. Yeah, spillover.
Yeah, so maybe I'll bring the two comments together about the soft conditionality and the increased spillovers, because we had an interesting discussion about whether it really counts as a spillover that people who are not receiving the cash transfer still attended the nutritional training sessions. And from one point of view, it might be they were attending the nutritional training sessions because they hope to get some kind of other benefit, but I was making the argument that that should still count as a positive spillover, because when you're counting the number of beneficiaries of the program, it's not just the people who are getting the cash transfers that you would initially think are the people who are benefiting the program. It's also everybody else in their community who are indirectly getting the information from the community health educators, and in some cases changing their behavior. So I told you before, Dan, that we don't have a way to separate out the impacts of the cash transfers from the training. The only indication we do have, though, is within the control group, we see some positive trends in behaviors such as sanitation and in knowledge. And given kind of the context in Yemen, we don't think that there's any reason for a positive time trend there, other than the fact that these are positive spillovers from people who have been attending the nutritional education sessions. So to come back to the point about linking with the soft conditionality, the idea is that just by, you don't actually have to have a hard condition to say that you're going to take away the cash transfers from people if they don't go. What this evaluation shows is that it was very successful in getting people to attend the nutritional education sessions just by telling them that it's part of the program. So that's, I think, an approach that can be used more broadly in terms of getting other people to sit on interventions where there's fairly low marginal costs of just having a few more women from the community also joining you to sit down in a living room and talk about nutrition. And it doesn't necessarily have to be that you threaten people to get them into the living room there. You can just tell them you should be going and your neighbors are going, and it's part of this program.
On the point of whether the World Bank will reconsider moving money away from the unconditional cash transfer, I don't think that's my sort of decision. But so what I will give you is my personal view on the matter, which is that we're very encouraged to see that soft conditionality works. So that is something, we're very conscious of. At the same time, the unconditional cash transfer, which is a targeted cash transfer targeting about 30% of the population, providing very modest sums of money, but which are very useful to people, targets a group of people far beyond those who may be at the risk of malnutrition. There are poor households with, with a different demographic composition, people who are elderly, people who are unable to work, and so on. So those vulnerabilities are what this unconditional transfer seeks to address. So it's not a complete substitution that one can attempt.
There were several questions here in the room, so I would like to take those questions because we are running short of time. So, and then I would like to ask our speakers to include those answers in their final remarks. Lieven, 1, 2, and 3, and a very brief one, 4. please be brief.
Yeah, thank you for the presentations. My name is Lieven, I'm from PHN from IFPRI. My question was about the title, actually, Prevention of Malnutrition. And you have a cross-sectional design, so you really assessing prevention is difficult. So I was wondering, do you have data on the treatment coverage of severe acute malnutrition or moderate acute malnutrition? Did that change? And do you also have some ideas from the health centers if treatment was better, if women were more compliant to the treatment? Because it's a very difficult one, and like someone mentioned, the transportation cost and these kind of things, that's very important.
Please hand over the mic to the gentleman behind you.
Hello, thank you for the presentation. It's been very engaging. My name is Mikhail Walcott, and I recently graduated from Princeton. And I actually interned with a humanitarian organization that implemented a cash transfer program in the Middle East. And one of the concerns that donors had about supporting this program was that funds would be diverted away from women and beneficiaries towards other purposes. For example, if their husbands coerce them to use the funds for...
Excuse me, your question, please. We are really short of
Yes,
time.
sure. Okay. And so my question is just, is that a concern that came up in this program, or is it a concern for cash transfer programs as they expand outwards?
Thank you.
Hi, I'm Maggie Holmschron from USAID's Office of Food for Peace. My question is about COT. There wasn't any mention of COT in this presentation, and I'm wondering what observations you had about the consumption of COT and related to the cash transfers in the homes for the families that were included.
Thank you.
Hi, my name is Yeong Lee, intern from IFPRI. I'd like to ask one specific question regarding women's empowerment that goes to Sikandra. I'm curious if there's any impacts of cash transfer on women's decision-making power or bargaining power within the household. Thank you.
All right, so I would like to give the mic back to our panelists, and I would like to start with you, Jacob. Your 30 minutes final remarks.
Sure.
30 seconds, sorry.
30 minutes, man, great. Let me tell you what I think. Yeah, I think diversion is a huge issue for donors, but it's an issue that's throughout humanitarian programming, and there's no evidence that cash is more easily diverted or less easily diverted. And in fact, I think people think that, especially with mobile transfer opportunities, that cash may be easier to do monitoring and evaluation of. And my last point would be the policy brief discussed that malnutrition existed prior to the conflict, but ultimately resolving the malnutrition issue in Yemen is fundamentally predicated on a political solution to the crisis. These interventions can only go so far.
I want to agree with everything that was said. And thank you for coming, and thank you for inviting me. I learned a lot.
Okay. I'm going to try and cover the last round of questions quickly. The one from Lieven about whether women were more compliant to the treatment. We did collect data on that because there was, at baseline, we noticed that there were a lot of issues with compliance with the treatment and returning to the health center. We saw that it improved over time between baseline and ex-post, but there wasn't a difference between the treatment and control group. So it could be that this is another case of kind of positive spillovers from having the community health educators in the community, that's not something that was driven by the cash transfers, but improved in both treatment and control groups. And then the second two questions were about diversion, and then specifically on COT, which might be one way it's diverted. We did collect data on COT consumption, and there's no significant impact of the cash transfers, which is pretty consistent with what other studies have found. So it's not being spent on COT, it's being spent on food primarily. Women's decision making, we had our kind of women's empowerment module was very short. We didn't have really detailed questions on decision making.
Just my final word is just again to what at the beginning Sikandra said, that this program has a very important impact on the thinking of women, that they want to educate their girls. So the community educators have a very positive role in the community. And even you have seen in the short video that when she said, the project is ending, but my role in the community is not ending. And the mothers were looking up highly to the community educators, and they want their girls to become like the community educators and to get education and also to good job. Thank you.
In my concluding remarks, I'd just like to say I agree with Jake and Dominic and Sikandra and Lamis, and I thank Olivier for moderating a very exciting discussion which got us all to agree. Thank you.
Thank you. The last final words. So please join me in thanking our great panelists for this excellent event. I would also like to let you know we have recorded today's event. It will be available in a couple days online from our website. Here in our room to you, our panelists will maybe stay around a little bit, so please continue engaging with them. And also to the online audience, everything will be online, and I'm sure some of our panelists will be able to also respond to your emails. So please join me in giving our speakers a great hand.